What does fatty breast tissue mean for breast cancer screening? Imagine looking at a mammogram and seeing a dark background with any potential tumors showing up as white spots. That's because fatty breast tissue appears darker on these images, making it easier to spot abnormalities. When your breasts contain mostly fat, it means the tissue is less dense, which is good news for screening. Dense tissue, which has more fibrous and glandular parts, appears white on mammograms and can hide tumors, making detection more challenging. Having fatty breast tissue usually means mammograms are more effective at finding cancer early. Since tumors stand out clearly against the darker background, the chance of missing a cancer is lower. This makes routine screening more reliable for women with fatty breasts. Additionally, women with predominantly fatty tissue tend to have a lower overall risk of developing breast cancer compared to women with dense breasts. Dense breast tissue is linked to a slightly higher risk and can make tumors harder to see on imaging tests. For women with fatty breasts, standard mammography screening is generally enough. There's usually no need for additional tests unless other risk factors are present, such as family history or genetic predisposition. This means that for most women with fatty tissue, sticking to routine mammograms at recommended intervals is sufficient for early detection. In contrast, women with dense breasts might need supplemental screening methods like three-dimensional mammography, ultrasound, or magnetic resonance imaging to catch cancers that could be missed. Breast density, including whether your breasts are fatty or dense, is now considered when planning screening strategies. Women with fatty breasts and average risk typically follow standard screening schedules. Those with dense tissue or other risk factors might need more frequent exams or additional imaging to ensure nothing is overlooked. In summary, having fatty breast tissue generally makes mammograms more effective at detecting breast cancer early. It also correlates with a lower risk of developing the disease compared to dense breasts. Most women with fatty tissue can rely on routine mammography without extra tests unless their doctor recommends otherwise. Remember, each person's situation is unique, so it's always best to discuss your individual risk and screening plan with your healthcare provider. They can help tailor the best approach for early detection and peace of mind.